Hello, and welcome to another edition of Dialogue. I'm Philip Klein, and today we're going to be talking about the subject of reform conservatism. Joining me today is Yuval Levin, who wears many hats, including fellow at the Ethics and Public Policy Center and as editor of National Affairs. Before we get going, I just wanted to clarify. We've heard a lot of talk about reform conservatism. When you think about that, do you think of reform conservatism as reforming the conservative movement or presenting policy reforms to change government policy in a more conservative direction?
Well, thank you, first of all, and certainly the latter. The way that I think about it, I think the way that most people who are sort of identified in that group think about it is that it's a conservatism that is directed to reforming our governing institutions. I tend to think of it as a kind of applied conservatism. I'm not sure where the term reform conservatism came from or if it's intended as an insult or a compliment, but it seems to me that it's basically directed towards this outlook that says conservatism has to be applied to actual public policy, and that means given where our government is, it needs to be applied to changing the nature, the character, the purpose, the role of our federal government in particular, and government in general. And so it's an approach to government that seeks to reform how we govern ourselves. It's not about reforming conservatism. I think it's really about applying conservatism.
Okay, now recently you helped put together a book with the YG network called Room to Grow, which tried to sort of compile a lot of ideas. Can you tell me about the impetus for the project and what it's all about?
Well, Room to Grow is really an attempt to put in one place some of the backbone of a conservative middle-class agenda, as we understand it. Again, it's an attempt to apply conservatism. The reason we thought it was necessary, in large part, is that in the last few years, conservatives have been focused on defense, have been focused on opposition, for understandable reasons. They've been out of power, and the Obama administration has been pushing to the left to an extent that has been very troubling to conservatives. And so the conservative movement has been focused on opposition, and I think has been focused in such a way that the Obama years have been a little disorienting for us conservatives. And as we start to think again about how to approach the public as a potential governing movement and how to approach the public as an alternative to what the left is offering, I think conservatives need to think again about what our ideas and our way of thinking about government has to offer people who are confronting problems in their real lives. That means that we can't start by saying that we think what the left is doing is unacceptable. Of course that's true. But we have to start with an understanding of what people's concerns are, what the country's problems are, which aren't always the same thing. And we then have to offer a sense of how a conservative approach to public policy and to politics and to American government would translate to real solutions, both to the problems that government has created, which is really a lot of what this agenda is, and to the problems that the global economy creates, the challenges that the country confronts in general. So Room to Grow begins that way. It begins with a sense of what public concerns look like, what the American middle class is worried about today. It then proceeds into a discussion of what the conservative vision of government looks like, what it means to think about governing as a conservative, which is to say not government as the manager of society, but government as an enabler of solutions that can rise from the bottom up. And then it offers an agenda, a series of issue-by-issue chapters: healthcare, education, taxes, the safety net. How does government look different if conservatives get to govern? And I think what it adds up to is a sense that the federal government really could work if we understood what its proper limits were and what its actual role was, which is not to run the United States of America, but to enable our society to address its problems. And so it tries to be both a kind of vision document and a concrete policy agenda. And we think it's necessary really because these ideas have been floating around for a while but have not been put together in a way that makes it clear that there really is a vision here and an agenda here.
Okay, now a number of liberal critics of the reform conservatism have looked at it and said it doesn't really seriously depart from conservative ideology, and they see it as reform conservatism should be forcefully attacking the Tea Party. And what do you have to say to that?
I very much disagree with that. I'm glad they think it's not a departure from conservative ideology. It's certainly not a departure from conservative ideology. It's an application of it to the country's problems. I think of what's being called reform conservatism as fundamentally an attempt to move the Republican Party to the right, not to the left. It's a response not to the Tea Party, but to an attitude among Republicans in Washington that has tried over the last decade or so, and in some ways much longer than that, to find ways to just live with the liberal welfare state as it is and maybe pay a little less for it, maybe take a little bit off the top of the cost of the federal government as we know it. What the conservative approach to government says is that that basic approach, the liberal welfare state, that begins from a sense that it's the government's job to manage and run our country's institutions, is not going to work. It's founded on a misimpression about what American society is. It's founded on some very large mistakes about how politics works and how human communities work. And conservatism points in a different direction, which means that the Republican Party, if it's going to be the conservative party in our country, has to offer an actual agenda that looks quite different, and that looks more conservative, not less. So I take it as a good sign that people like E.J. Dionne or other critics from the left say, well, this doesn't look like centrism. This doesn't look like they're moving in our direction. It's not an attempt to move in their direction. It's an attempt to move in a more constructive direction for conservatism to help solve the country's problems.
Mm-hmm. Now, to some critics on the right, some elements and some people who identify themselves as reform conservatives seem as if they're just trying to sort of bring back the kind of what was dubbed the compassionate conservatism during the Bush era. And a lot of those policies, Medicare Part D or No Child Left Behind, expanded the government role. And so that's led to a lot of suspicion and in many ways sort of triggered the Tea Party response. Where do you see the relationship between what was called the compassionate conservatives a decade ago and reform conservatives now?
Well, I think one of the problems that compassionate conservatism had was that it wasn't clear about the intellectual foundations of its basic approach to government. It was clear that the federal government wasn't working. There was a sense that things needed to be more decentralized, more bottom-up. But there was not a sense of that being the sort of core defining principle of what conservatives have to offer the country. So that when it came time to make substantive compromises, the core was compromised away immediately. Think about No Child Left Behind. No Child Left Behind began with some very useful and practical school choice ideas, and with this notion of testing and accountability. The Democrats said the school choice stuff is unacceptable. The Republicans said, okay, well, you take the rest. The school choice ideas were absolutely crucial to a different approach to education policy from Washington. But because there was no prioritization, because there was no kind of conceptual core to what they were after, they traded away the substance and kept the less important, at least, elements of their own agenda. I don't think Part D worked quite the same way. Medicare Part D, which I don't really see it as part of compassionate conservatism anyway. I'm not sure how that would work, but I think that the intention there was to introduce competitive pressures into the Medicare system, to introduce a premium support concept into Medicare, to have it work and then serve as a model for Medicare reform more broadly. I think that has happened. That program is working. You know, the Bush administration was in a situation where there was enormous pressure for a prescription drug benefit in Medicare. It's hard to imagine Bush would have been able to become president if he hadn't offered one. And the one he offered was an attempt to change the core structure, the way in which the Medicare program works. I think it's had the effect of introducing premium support into how we think about Medicare, and now you've had every Republican member of Congress vote for a premium support transformation of the larger Medicare system. I think that's good, and I think that's a step in the right direction. Obviously, Medicare Part D should have been paid for, and I can't imagine how it happened without being paid for. But the notion that you can take a public program and turn it into a market-oriented, competitive system for providing services, I think is a useful model.
But I guess the issue is that this was an example of government, a conservative administration, a Republican administration, expanding and offering a benefit that didn't exist previously.
Sure. No, I agree. Now, the Medicare program existed, and if you're going to provide insurance coverage to seniors in 2000 rather than 1965, you're going to provide a prescription drug benefit. And I think as a political matter, there was just no question that that was going to happen after the 2000 election. The question was who was going to be able to make it happen, and I think what the Bush administration was able to do is make the most of that situation. Obviously, a larger transformation of the existing Medicare program along those lines would dramatically reduce the size and the cost of Medicare, would not increase it. And that's one of the ideas in this book, and it's also the organizing principle of the larger approach to healthcare. which is to use competition to address the inefficiency of the healthcare system rather than to use government control and regulation to address it the way the Democrats have done.
Could you explain how you think that right now Obamacare has started, it's been in effect for a few months, where you think the conservative response is or should be?
Well, is and should be, as always, are different things. I think that I think the conservative response should be, and I and many others have thought this from well before the time that Obamacare was implemented or even enacted, conservatives need to offer their own solutions here. The healthcare system has been broken by the federal government over a period of many decades, not just under Obamacare. The incredible inefficiency that makes it possible at the same time to have more and more people unable to afford coverage and the federal government going broke paying for coverage is a function of federal policy. It's a function of the design of Medicare and Medicaid, and it's a function of the design of the employer tax exclusion that makes it impossible to have a working market with people making choices that drive efficiency and lower costs and higher quality. Conservatives have to move the system in that direction. What the Democrats have done with Obamacare is move the system in the opposite direction, toward a more controlled, a more managed, a more regulated system. And you know, what you see is rising costs. What you see is people who are unhappy, even those who are in the system, even those who are covered for the first time in many cases, are unhappy with how it is working. I think conservatives are in a position to offer an approach that would cover at least as many people, but in a way that makes the system better and that makes coverage more affordable for more people. Those kinds of ideas are out there. There's one in the book. We've seen some proposed in Congress. There's a proposal in the Senate from Senators Coburn, Burr, and Hatch that I think is constructive, moves in the right direction. I know that others are working on similar ideas. I think that's very important, and I think that conservatives, in order to repeal Obamacare, have got to propose their own solution, a way to address the problem, which is a real problem, caused by bad federal policy through reforms of federal policy.
Now, for a long time, the sort of heart of the free market critique of the American healthcare system centered around the tax code and the bias in favor of employer-based healthcare. But the Republican proposals that you've mentioned, including what you've argued for, leaves the employer system largely intact.
Well, the critique wasn't exactly about the fact of employer-based coverage. The critique was about there not being consumers in the system, right? Third-party insurance provision throughout the system, which means the people getting coverage are not the people choosing what to pay for, and ultimately are not the people paying. And so there's no incentive anywhere for people to make choices that encourage quality, that encourage value, right, which is a balance of cost and quality. The employer system is a big part of that because employers are the consumers in that system rather than their employees who get the coverage. And so there are all kinds of mixed signals and there are all kinds of economic inefficiencies. The much bigger problem are the public elements of the system and the individual market, which is a total dysfunctional mess. Obamacare decided to make the individual market more like the public elements of the system. It's a highly subsidized and, more importantly, highly regulated insurance market through the exchanges. The first step to take is to deregulate that market and allow it to be a functional individual market in coverage. There would still be subsidies for people who aren't able to afford coverage, but the subsidies would work by allowing people to make choices rather than by forcing people to take what they're given. Obamacare tells the insurers what they can sell. It tells the consumers they have to buy it, and then it says there's buying and selling here, so this is a market. What conservatives say is there has to be an actual market because markets ultimately are a way of solving these kinds of problems, a way of finding more value-based ways of addressing economic needs. The employer system is part of that problem, but the way to address it is to create a functioning alternative in the individual market and gradually have people flow into that system, rather than, I think, to just kind of blow it up and expect that it'll work out very quickly. Republicans have tried that. John McCain ran on a proposal that was much more dramatic than some of what's being talked about now, and that really would have basically replaced the employer tax exclusion with an individual benefit. He was attacked for it. He was not very good at defending himself against it. But I also think it involved ultimately too much change for people who were satisfied. You have to work with the political realities of a system like this, and so you've got to go first of all where people feel there is a problem, and then create a working system that acts as a model for the rest of the healthcare system. I think that's a more appropriate way, a more politically plausible way of solving this problem than telling people we're going to create even more disruption than Obamacare created, but trust us, it's going to move in the right direction. I think it would, but that doesn't mean that people should trust us.
Mm-hmm. Now, you mentioned regulations in Obamacare. Now, one of the popular regulations is the getting rid of the ban on insurers offering pre-existing conditions. And that's also typically an issue that whenever Republicans talk about repealing Obamacare, liberals will throw it out back in their face. How do you think that you create a functioning free market that also covers people with pre-existing conditions?
Well, a couple of things. The proposal in the book takes that up at some length. It's written by Jim Capretta, who's been one of the innovators in this area and one of the people behind the kinds of ideas that are now in that Senate proposal and in other ideas. It does two things. First of all, it provides people with protection if they're continuously covered, so that rather than have an individual mandate that says you have to have coverage or you pay a fine, it says if you are continuously covered, then when you move from one insurance plan to another, you're not risk rated again, which means that if you stay in the system in some way with catastrophic coverage for which you would get a subsidy in the individual market, or with employer coverage, or with coverage that you buy with your own money out of pocket, if you're covered, then you're in the system, and when you move from one place to another in that system, you don't get risk rated. So there is protection for people with pre-existing conditions. The second thing it does is for people who have a pre-existing condition, when the system gets going, it provides access to state-funded and federally funded, partially federally funded high-risk pools, which are a temporary measure to allow people into the system to become continuously protected in ways that are subsidized. And you know, high-risk pools have always been part, or at least for a long time have been part of how conservatives have thought about addressing this problem, because they're ways of allowing people to all be in one system but bridging the gap in cost between them. But basically, there's a huge incentive here to be covered, whereas Obamacare makes insurance coverage much less attractive to healthy people but tells them if you don't get coverage, you get fined. This approach would make it much more attractive by making it both cheaper and more valuable at the same time, and it would give them a huge incentive to be covered when they're healthy, because that's the way to then be covered when you're sick without higher costs. And so it would try to use consumer incentives rather than trying to use regulatory coercion.
But I guess one question I'd have is during the transitionary time, because right now under Obamacare, there are a lot of people with pre-existing conditions who are able to get coverage. So if we repeal Obamacare and move to your alternative...
Well, those people are covered, so they would be considered having been continuously covered, and they would not be risk rated under this new approach.
So, but if you have that at the same time, though, that you're saying that people can maintain that insurance, but you're getting rid of the employer mandate or the individual mandate, how do insurers who have to cover those people still and continue to offer coverage to them not worry about having to raise rates? Because if people who are no longer mandated to get coverage leave the market, but a sick or risk pool sort of keeps their continuous coverage.
Yeah, well, again, this system is based on making insurance more attractive, on expecting people to buy it because it's appealing, not because they're required to. And so the idea is there are a lot more options. Insurers have a much wider range of products they can offer, starting with catastrophic coverage, which is really the value that insurance provides you ultimately. It's a financial service, it's not a health service. And so there'd be a much wider range of coverage options. There would be some subsidies for people who are now in the system and who are not now in the system. And there would be this protection for continuous coverage. That's not to say that there wouldn't be a transition period where things were a little uncertain. But in that transition period, all the incentives would be for everybody involved to remain covered and to continue offering coverage. And so, you know, the basic idea is to get from here to there. And remember, Obamacare is a small system at this point. You're talking about people newly in the individual market to the tune of 6, 7, 8 million people. It can be done, especially if you make an economically rational system. Insurers should want to cover people. That's their business. The idea that insurers are going to run away from everybody in the system and only want to cover healthy people, that only works in this kind of communistic system where everybody just has to follow the rules that CMS writes, and you can't expect economic incentives to work. But the fact is, insurers want to sell their product. And if they're allowed to sell a product that consumers want to buy, then there will be more insured people in America.
Mm-hmm. Now, on the tax policy issue, in Room to Grow, there's discussion of tax policy, and a lot of it is focused on saying, okay, we need to move away from this sort of myopic focus on adjusting individual income tax rates. When Ronald Reagan proposed it, marginal rates were at 70%, and they've gone down significantly, so that's not helping as many people when you do that. But a lot of the response from reform conservatives has focused on sort of family-friendly tax reforms. And I just wonder whether or not in this sort of move to sort of expand the conservative arguments to a broader electorate or broader number of Americans, that the emphasis on families disregards the fact that there are a lot of people who aren't in families. I mean, in the exit polls in 2012, Mitt Romney clobbered Obama among married voters, whereas if you look at unmarried voters who made up 40% of the electorate, Republicans got clobbered. So the question is how to reach people who are unmarried, and does this focus on sort of family-friendly tax reform not really reach those people?
Well, I think there are a couple of things going on there. First of all, in thinking in general about tax policy, I think that there is a tendency for people on the right to just kind of finish sentences that other people started in the 80s and not think about why those sentences started the way they did. Tax policy was and is a barrier to economic growth and to upward mobility. It takes too much money out of the pockets of working people. It did that in the 1970s through the income tax. It does that now largely through the payroll tax. And conservatives have been too willing to accept this idea that the Democrats have always insisted on, that the payroll tax is this sacred thing because it funds Social Security and Medicare. It's a separate thing. It shouldn't be thought of as part of the larger tax system. Of course, that's always been a fiction. And we're in a situation now where the payroll tax is most of the tax burden that most middle-class people pay, and it's untouchable, and you can't help them with it. We even had a temporary reduction in the payroll tax that Democrats and Republicans together agreed to allow it to rise back up a year ago. That's a huge mistake. Conservatives have got to be open to thinking about the tax system as a whole, and especially where it affects actual people, and especially people who are under economic strain, and that's the payroll tax. The family-friendly component here is, in part, an attempt to try to address what I think is a mistreatment of parents in the tax code. If you think about how the tax code works and how we spend the money that comes through the payroll tax in particular, there's a way in which our entitlement system, which is an old age entitlement system, taxes parents twice because it taxes them as they're working, and they're also paying the cost of raising their children, who then become future taxpayers. It's mitigated somewhat. There are benefits for parents in the tax code. But I think that there can be a lot more of that, and it would make sense for there to be a lot more of that. And so what Bob Stein proposes in his chapter in this book is an increase in the child tax credit that is combined with and that makes possible a larger simplification of the tax code. That is, you can't just sell simplification to voters. It's much too abstract. It doesn't actually affect a lot of them. But it's necessary to enable economic growth. And part of the argument that Stein makes is that if Republicans are going to improve the tax code at that level, they need to offer people a concrete benefit. And a logical place to do that, which is a place that actually addresses a policy error or an unfairness in the tax code, is by increasing the per-child tax credit. I think we need to lower taxes for everybody. And I think we need to lower the payroll tax for everybody. But if the question is where do we start and how do we enable a larger reform of the tax code that allows the economy to function better, tax relief for parents as a political matter is very popular, extremely popular. It's probably the most popular idea in this book as a general sort of electoral matter. And it's also a good idea, and it's also good policy, and that's not a bad combination. So as a place to start, I think that's a pretty good place to start.
Now, 2015 is going to be the year when the presidential candidates start announcing that they're going to run. Mm-hmm. In 2007, when the 2008 primaries were heating up, a lot of liberals were very good about sort of getting their presidential candidates to commit to certain specific policy goals, whether it be universal health care or cap and trade and so forth. Yeah. If you were advising a Republican presidential candidate, what specific issues or policy points would you think are really sort of fundamental for them to get on board with?
Well, I think that a Republican presidential candidate will have to offer an alternative to Obamacare. That is, that repeal will have to be combined with replace, and with a plausible, functioning, sensible, conservative alternative on how to address health care. I think that's essential. I think that candidate will also have to be behind entitlement reform, especially Medicare reform, because ultimately any Republican candidate, I think any serious presidential contender, any serious American, has got to think that the fiscal problems we have got to be addressed before they become catastrophic. And frankly, Medicare is at the very core of that. And, you know, Republicans are there, and it's very important that they don't backtrack from that place, so that the next Republican candidate cannot be less conservative than Mitt Romney on entitlement reform. I do think that a Republican has to offer tax relief to the public. And if that looks like the kind of Mike Lee, Robert Stein proposal that's in this book, I would certainly favor it. If it looks different but is plausible tax relief that makes possible a broader tax reform, that would be great and very important. I think a Republican candidate has to talk about higher education. It's one of the places where the cost of living in the middle class has dramatically increased over the last few decades, and it's pure inflation. You're paying more and more for the same thing at best. And again, it's a place where federal policy has distorted things in ways that make life in the middle class more expensive and more difficult. And there's an obvious Republican approach, and that's also laid out in this book, to using basically market mechanisms and consumer-oriented mechanisms to bring down the cost of higher education. I think Republicans have got to be in that place. It's very important. And it's an opportunity, too, because Democrats really can't be there. I think you've got to talk about the safety net and the ways in which the welfare state is failing the poor. And again, there are some obvious opportunities also laid out in the book for Republicans to think differently about how the safety net should work as a way of getting people back into the workforce rather than as offering an alternative to the workforce, which increasingly, amazingly, is how the left is actually talking about the safety net. So I think there's no shortage of opportunities to show the public what conservatism in practice would look like and why it would be better for the country. Frankly, what we've had a shortage of is a willingness to do that. I think Republicans have taken it as a genuine question whether they should have a policy agenda. That's crazy. Of course they should. And the way it ought to look and the way it ought to work at this point is pretty easy to see. So I think there's no excuse for a Republican presidential candidate not offering a serious agenda on those kinds of issues.
And that's why I think this year is an important time for conservatives to kind of hash out these policy debates. So thank you for joining me here today, and thank you for joining us for another edition of Dialogue. See you next time.